Again, we are having yet another session of IHDE and IHDE, the exclusive session by Dr. Ihde and Antonina ma'am. And we are going to have two most interesting and most innovative lectures. We are going to have it, and that's how we are going to enrich our knowledge by the two great lecturers, what we are going to have right now. Thank you, Ihde sir, and thank you, Antonina ma'am, for coming up for the lectures. Okay, thank you very much. And yes, Ihde sir, it's up to you now. Thank you very much.
Thanks a lot, Dr. Vivek. Well, in general, the idea to this lecture, the idea behind it, came from Lukas, because some time ago when we were in Jari on a course, he taught me, this two-stage implantology, actually, it's not a science. It's basically, I don't know, they are doing something, but it's not a science, because if it doesn't work, they don't know why. And I heard this idea the first time, but I have to admit that I followed this idea today, and I want to explain you why I think that these thoughts of Lukas are right. I think we should think the same way. If we are thinking in terms of science, if exploring things and so on, then we definitely have to follow this idea. Now, I have made over the years a long list of reasons why implants can fail. So this is written here, reasons which dentists and implantologists give to the patients, explain why two-stage implants were lost. So the implant is lost, is out, and the doctor has to explain something, and now it becomes interesting. So maybe there was a pre-existing infection in the bone. This is one of the explanations. I think everybody will agree that's possible. No? So the infection was from the tooth. Maybe there was a granulation, maybe some, I don't know, a little bit of osteomyelitis even left, whatever, and the implant came out. The other option is that the infections were inoculated into the bone during implant placement. Or there was too much insertion torque. I think many of you may have heard the same. Too much insertion torque can be a reason for loss of implant. On the other hand, we also know that not enough insertion torque can also lead to a loss of implants. So this is kind of primary stability missing, or not enough primary stability for the remodeling to take place, something like this. It's somewhere in the direction of bad bone, but bad bone is another point why things can fail. Then, very interesting, also allergy against implant material, titanium allergy, titanium alloy allergy, all these things which are then explained to the patient. It's like you have a little bit probably pre-existing infection in the bone, and I already noticed that the insertion torque was not enough, and probably you had a little bit of allergy. Maybe we cannot really test this, but I heard it's possible. So in a way, number 6 is a little bit idiopathic, and that's why you lost the implant. Some patient sits there in the chair, what he can do? The implant was lost, so what to tell? Then some doctors think that this rough implant surface is somehow connected to implant loss. And there are then other doctors who are thinking that polished implant surface are connected to implant loss. And then, of course, we come to the patient reason, misuse of alcohol. I never know, is it the patient misusing the alcohol or the doctor? But this is mentioned often. Then smoking, maybe the patient smoking, maybe in the environment of the patient, somebody smoke, for example, in his pub, and then the implant gets lost. Then, of course, general diseases, always very, very nice to use them as an explanation, like diabetes, high blood pressure, and all kinds of diseases probably can be connected to this. So the doctor just reads the patient record down a little bit and then explains to the patient why this implant has failed. Then there are some countries where people are very superstitious, so they are kind of thinking maybe it was done in the wrong moon phase. Simply the implant was put in the wrong moon phase, and then the implant failed, because of course there was never a chance that this could work if operation is done on the wrong moon phase. Then, of course, this is what we are being told sometimes by the universities or by some expert, that the wrong implant brand was used. So, for example, the Straumann guy will tell you, hey, listen, this was a Brennemark implant. This never had a chance to be successful. And the Brennemark guy will say, no, it's our implants anyway the best. And these Straumann things, they come out. So in any case, it's the wrong implant brand. And as we have more than 1,000 brands on this world of two-stage implants, so